Hello, welcome. We're on the amputation page for the thumb in the Upper Limb Impairment Calculator. The reason for this is that some people have expressed concerns about the way amputation and to a greater extent sensory loss is dealt with in the Upper Limb Impairment Calculator. It is exactly the same as the guides do it, but it's a slightly different approach. So with amputation, we measure the amputation stump and say it's the distal phalanx, and we compare it to the uninjured phalanx on the contralateral side. So if we say the amputation stump is 20 and the uninjured one is 40, then we get an amputation value of 25, which is something that most would know off the top of their heads without looking in the guides. And it's the same for the other phalanx in the thumb, and in the fingers you've got 3 phalanges. Sensory loss is exactly the same sort of concept. What you're doing is you're measuring the length of the uninjured or unimpaired part of the whichever phalanx it is. So if the distal phalanx of the thumb was numb to within 10 millimetres of the interphalangeal joint, and we know that the phalanx would have been 40 millimetres long if it hadn't been amputated, then we got a partial value of 4 or complete value of 8. But what I'll do is I'll assume that the whole of the distal phalanx of the thumb is numb, because these are numbers that people will know off the top of their head. Complete sensory loss 10%, and we'll do the same thing on the ulnar side. Now obviously the ulnar and radial sides do not need to be the same, both from the point of view of the level of injury and whether the sensory loss is partial or complete. I prefer the term complete to the term total, which the books use. So make that complete, and then we get a total sensory loss value of 25%. Now most would know that value off the top of their head, but we have to correct for amputation. So if you correct for amputation, what is happening in the background is a sensory component matched for partial and complete of the amputated part is being subtracted from this figure here. So we go back. We know that the amputation value was 25%, so the sensory component of the amputated part is 12.5%. Go forward, we subtract 12.5 from 25, we get 12.5, and it's rounded up to 13. The subtracted value is unrounded, that way it's fairest to the patient. You can do the same thing with the other phalanges. You don't have to have the amputation in the same phalanx as the sensory loss, and it's simple and straightforward. If there are any queries at all, please contact us through the website. Also, if you've got any suggestions for improvements or things you don't like about the app, again, please contact us. There will be a Android version coming out soon. That's in testing at the moment. Thanks for watching.